Nomi Health is a new player in the Michigan health insurance marketplace that employers need to know about and few do. Nomi is an interesting name. Its origins come from no middleman, and the founders in Utah decided to build a company that's going to put employers in a position to control their healthcare like they haven't been able to before. Nomi Health is looking to disrupt many aspects of healthcare, including how we access providers and how we access our prescription drug benefits. Today I want to focus on the network side of things, but before I do, let me highlight the other key components of what Nomi has in their portfolio. Nomi's purchased a pharmacy benefit manager by the name of Surpass, an independent, transparent, fiduciary-minded PBM, which is bringing a lot of transparency and control to the pharmacy side of health plans. In addition, they bought a data analytics predictive modeling tool called Artemis, one of the preeminent predictive modeling tools in our industry that many Fortune 500 companies use as well. In addition, they have a payment platform that's used to pay providers directly that frees up the method of passing dollars from a health plan to providers and cuts the middleman out of the process. But the crown jewel in their portfolio is the network that they're building. Historically, we've known of Nomi over the last couple of years as a vendor we could go to bolt on to self-funded plans to provide bundled surgical pricing primarily. So if I was looking for an opportunity to provide access to a high-quality provider for one set flat fee, all in, Nomi was a tool I could use. Starting in 2023, Nomi set out to broaden the network options they're offering employers that sponsor self-funded health plans, and they've targeted Michigan as ground zero because we are the second least competitive health insurance marketplace in the country. Now they have all Trinity Health providers throughout the state of Michigan in their network. They also have signed on Holland Hospital along the lakeshore. So for West Michigan employers, all hospitals along the lakeshore are now in this Nomi network. Additionally, there's many other providers that are very interested in signing on. There's going to be a very robust network with a lot of access for employees throughout the state. What Nomi is doing is ultimately building a network that self-funded plans can tap into that provides the most competitive pricing in the state and significant benefits to employees as well. Historically, employers had two options when building a self-funded health plan. They could work with carriers that provided basically a bundled package. The advantage is oftentimes those provider networks had better discounts for the health plan, providing in better savings over time for all medical services that ran through it. The downside is very little control, no flexibility to use creative ideas to better manage the health plan. The alternative is partnering with an independent third-party administrator where you can choose your own adventure, but to access providers, you needed to use what we call rental networks historically. So these are networks that gave you a lot of flexibility and you could choose which one you wanted to use, but the downside is the discounts weren't as significant as insurance carriers have been able to achieve. Nomi is turning this reality on its head. So why would employers want to consider using the Nomi network? They first and foremost know that they can maintain entire flexibility and have the ability to choose any plan administrator that's the best for them. Additionally, they can use many different cost containment strategies on the pharmacy side, the medical side, or otherwise to control their costs as best as possible. They are now, if leveraging the Nomi network, in a position to provide their employees with a 100% plan with no out-of-pocket expenses for employees when they use the Nomi network. So employers now have the ability to detach themselves from carriers that they may have historically used that had the best discounts and use many other strategies to control costs at the same time. So this is all evolving very quickly. We anticipate by 2026 it's going to feel very mainstream. If you're not talking about the Nomi network, you're missing out, and you really should add that to the list of things that you're considering.